Now let's talk about epilepsy as the 23rd emergence in first aid in this playlist. Epilepsy is just a disorder of the brain which is characterized by repeated seizures. A seizure is usually defined as a sudden alteration of behavior due to a temporary change in the electrical functioning of the brain. Okay, so the brain's electrical impulses are not okay. So someone just changes the way they are behaving. So that is what leads to an epilepsy. Okay. So when the convulsion ceases, the victim is going to fall into a deep sleep. So if this behavior that they are showing stops, the victim is going to go into a very deep sleep. If aroused, he will be confused as as to time and place. Okay, he'll be confused. They don't know what the time is, where they are, and such. How do you get to treat this? So during the convulsion, when the person is reacting and behaving like that, remove any object such as furniture against which the victim could hit himself. Right? Do not attempt to stop the victim biting his tongue. Do not place your fingers anywhere near his mouth because you can lose your finger. Keep the victim on his side and the airway clear after the conversion. So after the victim stops behaving the way they were behaving, remove them. Okay, keep them on a side where there's going to be some air going in. Okay. A conversion we are talking about is a medical condition where body muscles are involuntarily contracted and relaxed due to disruption of nerve cell activity in the brain. So like that they contract, they relax like that behavior. Okay. Once the victim regains consciousness, reassure them. It's going to be well, it's okay, don't worry. If the victim is not a non epileptic, you don't know that they have got this condition, maybe it is their first conversion, he should seek medical help. All right, very important. So you need to make sure that you encourage the victim to take the medication prescribed to him by the doctor. The medication is aimed at controlling the epilepsy. Okay. Parents with epileptic children will need to keep a careful watch on their child. It is particularly important that the child is kept away from the dangerous situations like fire and hot water because if they are on these places, immediately maybe the convulsion can start and then the water or the fire can actually do them more harm. Victims should be encouraged to lead a normal and independent life. But the fact that they have got this condition doesn't mean that they are not supposed to live normally. But just try to help them so that they are not involved in those situations which can injure them a lot in case these things are finding them. So that is it for this part. Thank you so much for watching. In the next class, we'll talk about how to handle bites and stings.